So, I wanted to jump on today just to talk a little bit about the state of our current healthcare system. Now, with our current healthcare system, now I'm not saying that, our current healthcare model is completely flawed, not 100%. It's good for certain things. So it's really good for emergency care. There have been a lot of amazing life saving technology that has been invented, like, say, for neonates that were born prematurely. So those are babies that were born a little too early. And many years ago, they would have never been able to live, but now they are able to live normal lives just because of technology. So I don't mean that, but I do mean that it does fail when it comes to people with chronic illness and chronic inflammation. And the reason why it fails because a lot of times when a person comes with pain, because our healthcare system is so specialized. So, I mean, there's like osteopath, okay, that's fine. But then there's so many different specializations of doctors that a lot of times they only look at that one body part that they were specializing in and kind of ignore the rest of the body. Now, that's not to say that all of the doctors are like that. There are some that literally will take care of caring about the whole body. But what I'm saying is, in our current medical system, many doctors, and it's the way medical school is. It's you learn, you cram all of this information in, but it's only about taking care of the problem after it has already happened. And the way it's taken care of is with surgery and medications, which, yeah, they work sometimes, but that should not be the first solution. And a lot of people are getting really frustrated, especially those that suffer from chronic illness and chronic inflammation, because they're tired of being, first of all, not listened to. The doctor spends less than 12 minutes in the room with the plate and with the patient, and they're never really being seen or heard the whole time that they're speaking. And they're usually, written off really quickly to give a prescription or schedule for surgery. Now, part of it has a lot to do with the system itself because of the way they go to school. They usually have to have a certain number of patients that they have to get done, that they have to see in order to get paid. So I get that part, but there are some doctors who are shucking that, who are saying, I'm not doing this. I care for my patient. My patient is number one. I'm going to take time with that patient. And then the other issue is the healthcare system itself. So there's two changes that really need to be made. And I think it's going to have to start with the healthcare policy, because healthcare policy is going to help force the changes with the medical schools, with the hospitals. So, like, that trickle down effect. And the people who suffer the most right now are people who have chronic illness and chronic inflammation, because they turn to natural or holistic or alternative medicine. There's so many names for it, but they turn to this because they realize that they're not being seen, they're not being heard, and they realize that there are other alternatives that are going to get them healthier. So until the policy changes, and not only that, the system is so expensive to do natural healthcare, which is kind of odd since it's natural. That's so It's so expensive, and a lot of times, a lot of practitioners are they have to charge a lot more, and so the patients have to pay out of pocket. Whereas our current medical system, it's covered by insurance, so it's a lot cheaper. I really feel it should be flipped for people who suffer from long-term illness, or maybe just a different way. I don't have answers. I'm not in the policy making ring, but I can speak from my experience working in the medical health field as it was a few years ago. And I can speak from it being on the other side in natural healthcare. So I've seen both sides, and it is astounding the difference. And it's unbelievable that it's not really taught as a mainstream, that natural healthcare isn't taught as a mainstream. It was many, many years ago, but it isn't anymore. And unfortunately, some of it has to do with greed, and there's so many other issues. So I just kind of wanted to just speak on that really quickly because it was on my heart, it was on my mind. And from seeing so many clients and the experience that I had working in the hospital, and from my own past experience, it's a mind-boggling system and the way it operates. So if you like anything that I said and you resonate with it, just leave a comment down below. And I thought I would just give you that piece of information that I thought was really important and I really just kind of need to look at. And just let me know if you agree or disagree.